All right, so this video is on general survey and inspection, and this is all going to refer back to chapter 4 in your textbook. When you enter your patient's room, of course, you're going to foam up after you've washed your hands, of course. But your inspection is actually going to start from the minute you walk in the room, and that is by looking at your client and beginning to notice just their appearance. What is their hygiene status like? Are they clean? Is their hair clean and fixed? Are their nails clean? What does their skin look like? You're going to notice things like, are they malnourished? Are they overnourished? Are they undernourished? Is their skin dry and scaly? Are there any evidence of any sores or lacerations? Any type of abnormalities that are just obvious to the eye. So you're going to introduce yourself to your patient. Hi, my name is Tara. I'll be your nurse today. Can you tell me your name?
Jill.
Jill. What is your birth date, Jill?
4/21/73.
Okay, so this is one way for her to identify herself with you, to make sure she is aware of who she is, and that her birthday is correct, and you would have checked that before you went into the room, actually, to know that you're going to see the right patient. But it goes to speak to her mental status, her emotional state, and to know that she is alert, oriented, and not confused at this point in time. You want to notice her body position, how she's sitting. Is she sitting up? Is she slumped? Is she leaning? Is there anything just out of sorts with that? You want to notice any body movements just while she's sitting and talking to you, any types of tremors, just anything in her movement that's out of the norm. All right. So let's do this. We need to get your height and your weight. Okay, so I'm going to ask you to walk over to the scale for me, Miss Jill. While Miss Jill is walking over to the scale, you want to notice how she's walking. You want to notice, first of all, is she having to use a walker, a cane, or any type of device to do that? You also want to notice, did she have any trouble getting out of the bed or beginning to walk? Did she get weak? Did she seem unsteady? So that's how you assess her gait and her balance. All right, Miss Jill, if you will step up on the scale for me. Ideally, we want them to have their shoes off so we get the best weight possible. If you're in a clinic setting, you kind of want them to have their coat off, their purse off, those types of things. You're going to document their weight. All right, Miss Jill, you can sit down for me. You're going to document their weight in pounds and in kilograms, most likely. Okay? All right, Miss Jill, let's see how tall you are. So we're going to use something called a stadiometer. I hope I said that right. So Miss Jill's going to step on, and she's going to move her feet all the way to the back. We're going to have her stand up as straight as possible. We're going to move this little paddle down to where it meets the top of her head. And if you'll notice on the side, there's two little black arrows. The one on the left is going to show you the centimeters, and the one on the right is going to show you inches. So she's about just over 66 inches, and we're going to document that because we will need those measurements to figure her BMI here in a few minutes. All right, Miss Jill, thank you. If you'll come back and have a seat back on the bed for me. All right. Other things that you would want to notice when you're doing just a general inspection of your client is their tone of voice, their affect, if they're responding to you with laughter, with smile, if it's appropriate for what they're saying to you. You also want to look at how they're dressed. Is what they're wearing going along with the season? Does that seem appropriate? That may be something you need to address, because if they're got on lots of clothes and it's summertime, there might be an issue there. You also want to notice things like, do they look their age? If you know that Miss Jill is probably about 28 years old, does she look 48 years old? Does she look 68 years old? Because there are medical conditions that can cause clients to look older than they actually are. All right, I think that's it. So the next step in your general survey or inspection would be your vital signs, obtaining your vital signs. And we have a video that we're going to upload for you guys that is really good, really in depth. Let me bring out 2 points that are in that video that we want you to notice that are different. One is the temperature that's being taken. They're using the scanner. You will see that, especially in this time and date. but we use oral probes most of the time, and you can see that in your book as well. Also, when you're palpating for pulse, you want to check for 60 seconds, not 30 seconds. You want to get a full 60-second count there as well. And then the last step is going to be documentation of what you saw, what you tested, the height, the weight, and what you observed with your client. And documentation is actually in your textbook in the very back between pages 481 and 484.